Hello everyone, my name is Dr. Joel Rosen and I am the clinic director here in Boca Raton for Boca Healthcare Center. And you came across my site because either you, a loved one, or a family member suffers with diabetes and you're looking for more information and you're looking for a solution to your problem. So I want to tell you that you've come to the right site and that you've probably never heard this information before and probably will wonder why once you hear it all, that your doctor hasn't done this for you. But in my office, we treat you both metabolically and neurologically for your diabetes condition. So what exactly do I mean by treating you neurologically and metabolically? Well, basically, when I treat you neurologically and metabolically, we leave no stone unturned when it comes to testing. First of all, we do metabolic testing based on specific lab panels. Most of you have already done a complete metabolic profile with blood work, but it's incomplete. And why I say that is because the majority of the time there's essential tests that are missing from those labs. So I always tell my patients to bring in their lab work, let me look over it, and let me explain to you what else you need to do, and it's done. Or let's look over your lab work and compare it to functional ranges versus sick ranges. And you'll see a lot of the time that the sick ranges or the lab ranges are reported high or low if you're within those ranges because you're sick enough to be compared to a sick person. Whereas healthy, normal ranges, you may be outside of those, and it's important to know which ranges you're in. But basically we do thyroid panel, complete metabolic profile, lipid panel, and autodifferentials with all the white blood cells. This will be able to assess your thyroid, your adrenal glands, your liver function, your kidney functions, your red and white blood cells. Basically, all these systems can be affecting your diabetes. When we address these problems, we can basically put an entire plan together to try to help you recover from your diabetes. But more specifically, other tests that we do is sensitivity testing. Sensitivity testing will let us know if there's something called a leaky gut. Our GI tract is basically from our mouth to our tushy, and it acts as a protective barrier from the outside, and many times there's holes in this protective barrier that is allowing sensitive foods that are not being broken down into our bloodstream. What I mean by sensitive is we have an immune reaction to those foods, and then those foods are passing into our bloodstream without being broken down, and it's creating an immune response where potentially our own immune cells are attacking our own tissues. That's what's called an autoimmune response. Type 1 diabetes is an autoimmune problem which needs to be controlled and managed through proper testing, knowing what the foods are that you're creating a sensitivity for. Majority of the time it's wheat, oats, barley, spelt, kamut, and other cross-reactivity foods like casein, dairy, cheese, yogurts, also soy, yeast, and eggs. These can all create inflammatory responses in your body, and that's basically putting off your immune system to try to fight that, and then it starts attacking your own cells. So we do sensitivity testing. Some of the symptoms of being sensitive to foods are chronic pain and fatigue, frequent indigestion, bloating after eating, frequent loose bowel movement, constipation, mouth ulcers and sores, and vomiting often. Most importantly for you guys, for the diabetes patients, is not only looking at the blood sugar values, which again, the functional ranges I believe are 85 to 99, whereas the lab ranges are above 120. So if you're in that no man's zone of 105, 106, and your doctor tells you, yeah, it's a little high, it's actually functionally a problem where you've started to develop symptoms already. But even more important, in my opinion, is adrenal stress index. The adrenal stress index basically measures the cortisol levels from the morning to the evening, and it should basically go from a nice high to a nice low, where you wake up in the morning refreshed, invigorated, ready to go, take on the world, and then your energy sort of dwindles throughout the day, towards the end of the day, where you hit the pillow, you fall asleep, and everything's nice. The majority of the time that's flip-flopped. You wake up in the morning fatigued, and you sort of get a little energy throughout the day, and then by the time bedtime comes, you can't fall asleep. Something's going on with your adrenals, and we need to address that and figure out where the problem is and try to address it nutritionally. So we do adrenal stress index in our office as well. We do immune panels. Immune panels are basically if you have an autoimmunity, which we talked about a little bit earlier, your immune system is attacking your own body. We basically have two ways of fighting off an immune response or some type of pathogen that attacks our body. We basically have Th1 dominance or Th2. When we're testing for Th1 dominance, we test for IL-2 and TNF-alpha. If we're testing for Th2 dominance, we're testing for IL-4, IL-10, which is Th2 dominance. Basically, once we figure out which dominant pathway you are, we try to quiet it down so that you recover from your, in this case, diabetes problem. Other problems are rheumatoid arthritis. These are autoimmunities. Sjögren's syndrome, lupus, scleroderma, Hashimoto's, Graves, multiple sclerosis, celiac disease, Addison, pernicious anemia, myasthenia gravis, dermatomyositis, Raynaud's, and type 1 diabetes. Again, these are autoimmune responses that potentially you may be autoimmune, and the only way to test is by doing the proper testing. And I usually like to tell people that when you come in with a chronic problem, you're not coming in with just diabetes alone. You could be coming in with depression, fogginess, lack of energy, lack of sort of zest for life. And a lot of these are because of the metabolic problems that are going on, which we're just mentioning, food sensitivities, gut infections, pathogens to mold, yeast, fungi, stuff like that, and adrenal problems, thyroid problems, even neurotransmitter problems, fatiguing of the brain problems. And if you don't do the proper testings to know exactly why you're having your problem, then it's going to be really hard to just take a pill and feel better. Like I said, we do panels to test your hormone levels, neurotransmitters, inflammation. Glutathione is something that we use in our office. It's the mother lode of all antioxidants. We've seen that really great changes with people that have chronic conditions when we provide this. It's a cream, so that's one of the things that we do in our office. We do brain-based therapy. A lot of you people with diabetes have neuropathies, and you have problems with body contour, spinal problems, headaches, neck pain, lower back pain. We have a non-surgical decompression in our office that we use. We do unilateral adjustments. We do wonderful things in the office. So basically ask yourself, how long have you had your diabetes, and how long have you been frustrated by it? Ask yourself if this is affecting your job, your relationship with others, your finances, activities that you'd like to do but you just can't. What is this costing you in terms of time, money, and happiness? Obviously, if you're on this website, then you're looking for another solution to your diabetes problem. Where do you picture yourself in the next 1 to 3 years with this problem? You're trying to do the same things and expecting different results is the definition of insanity. What is your time worth in terms of improving? What is it worth to improve your condition? I mean, how badly do you want to get better? I'm basically offering 2 free visits in my office. The first visit is a complete neurological evaluation to determine if there's a problem with your central nervous system. That manifests in sensory problems, motor problems, mental alertness problems, and body contour. We also do a neurotransmitter assessment, and we also do a metabolic assessment to determine exactly why you're getting this problem without being fixed. And then we do, on the second day, we go over our results and explain to you what is going to be required for you to get better. So basically that's my offer. I don't accept all the cases that come into my office, just the ones that I think I can help and that you want to try to help yourself as well. If you'd like to schedule your free visits, my number is 561-883-0090. Just ask for David or Brenda and tell them that you want the 2 free visits for your diabetic problem, and we will do what we can to try to help you recover. Dr. Joel Rosen for Boca Healthcare Center, thank you for coming to my website.